Hi, it's Ellie here, and it's a week and a half after my lobectomy. Just kind of checking in, letting you know what I'm going through and in terms of the recovery process and things that you might experience as well. Every time I bend over, I start coughing. So that's pretty much the norm for me. And I talked to the doctor, and the doctor said, yeah, that's par for course. So that might be one thing that you might be experiencing. I'm still having shortness of breath, coughing a lot even when I'm not bending over. It's almost like a burning in my bronchial tubes that I feel when I take a deep breath. That's what comes out. Besides that, there's a lot of nerve pain on the side of my body. Really, really sensitive. It really hurts. The one thing I have to suggest is use lidocaine if you can get them from your doctor. You want to get the lidocaine patches that are the prescription strength. Even though it says 4% and over the counter says 4%, it's a difference. The prescription lidocaine patches are so much stronger, so much more effective. And I have my pack here, and I paid 10 something for 7 patches, which is really good. It can go as little as 8 something. So let's see. Yes, lidocaine patches. These are something that you want to ask for. You put them, you obviously can't put them directly on the incision points, but you can put them around there. And like I said, my incision is actually over here, but I'm feeling it all here. I'm also feeling it under my arm. So these are sensations that you might experience as well. Also, happily, this is, as you know, my lovely spirometer, and I've gone, actually it's there now, oops. Yeah. I've gone from here right after surgery, which was 600, not good, all the way up to 1625. So 600, 1625, big difference. I made the biggest leaps in the first few days after the surgery, and now it's just little bits at a time. But that's okay. Just recognize that you might make the biggest leaps the first few days after surgery, and then after that might not be as big, but you're still trying to get higher. The other thing I wanted to talk about is how tired you might feel. I'm not talking about winded. I'm talking about just, I'm so tired feeling. I've been sleeping a lot, and you have to get up. Obviously, you have to get up and move around and keep the lungs moving, but don't be surprised if you feel like you need a lot more sleep. It's normal. That's the one thing that I knew I was going to be tired somewhat, but I've been really tired. And little things like cooking a small meal in the kitchen, if you get winded or you feel really tired or weak, you can keep a small chair in your kitchen. I have a galley kitchen pretty much, but I have a small stool, which I keep in the kitchen when I'm feeling really fatigued. Because the last thing you want to do is pass out. Bad thing. No. Especially if you live alone like I do. Feeling really weak, especially on the side where you had the surgery, that's completely normal. And if you feel a little down in the dumps after the surgery, sometimes, from time to time, that's okay. I mean, I I honestly, going through this alone is really, really tough. And keeping my spirits up is really, really tough at times. I find that reaching out social media is really helpful. But it is really lonely. It's something that's hard to go through. So try and get connected with a peer-to-peer group through maybe call the American Cancer Society. Maybe you know somebody in the community, someone who can help, who knows what you're going through. It's so important to have that. I can't stress that enough. And while I've been through cancer, I've never been through it alone. So definitely reach out. You have to reach out because it'll make it so much better. So this is Ellie signing off. Take care of yourself. It's going to be okay. You're strong. You can do this. Until the next video, I will see you later.